Hello, so this is a video for your chemistry assignments and just lecture review for Friday, March 27th. So we are actually going to go into our pharmacology book. Chapter 17 is electrolytes. With fluid electrolytes and acid-base balance. So fluids, so two compartments of body fluids. So there's intracellular fluids found within the cells or inside the cells, and extracellular fluid found outside of the cells. The human body consists of 40 to 70% water, which is why one of the reasons why that we need to remain hydrated, and what those daily requirements of water intake are daily. Body water varies according to conditions, body weight, sex, and age. So obviously a 7-year-old child that weighs 40, 50 pounds does not need as much water as, an adult male weighing, 180 pounds. So water deficits. So how do we lose water? We lose water through many different ways. Vomiting is one of those. We can become dehydrated very quickly if we're vomiting. So if we have the flu, stomach flu, food poisoning, anything like that. Diarrhea, that kind of goes hand in hand as well. You're just losing water the other route. Edema, so swelling, excess swelling or water holding or buildup in our body. That typically happens in the lower extremities, so hands, feet, ankles. Excessive sweating. So you can have excessive sweating when you get a fever. That can make you lose water. Excessive sweating during physical activity, so playing sports, working out, even being out in our hot summer heats here in Arizona. A lot of people can dehydrate very quickly, lose a lot of water. One thing is, if we've been in southern Arizona for any length of time, some of us have born and raised, some of us have lived here for, many, many years. We become used to and accustomed to this heat. We know what our body needs. So when you have people that are traveling here from out of state, especially if they're coming from a humid heat to a dry heat, that's actually a very different thing, and they can get overheated and dehydrated very quickly. Large urine output. So if there's a reason why you are excessively urinating, then you can lose a lot of water that way as well. So symptoms of water deficits or loss of water include dry skin and mucous membranes, wrinkling of your tongue, hypotension, which is a decrease in blood pressure, tachycardia, which is a decrease in your heart rate, heartbeat, and lowered body temperature. So fluids and solutions, IV fluids, these are used to replace fluids and electrolytes that are lost through dehydration. So if you've ever been admitted into the ER or into the hospital, one of the first things they attach to you is a normal saline bag. They're trying to replenish any water depletion and treat any dehydration that you might be suffering from. Tonicity is the concentration of a solute in a solvent, and how that concentration affects movement of water across the membranes. It only refers to molecules that do not move easily across the membranes. Excuse me. Osmolarity is the concentration of all molecules in a set volume of fluid. It refers to the molecules that do and do not move across the membranes. It's measured in millimoles. So one thing that you're going to see is actually some of our electrolytes are measured in millimoles, and that's how we determine which ones we're selecting off the shelf correctly. So instead of saying, milligrams, they're going to say millimoles. The osmolarity of blood plasma is between 275 and 300 millimoles per liter. Isotonic solutions have a concentration of solute similar to plasma, so the amount of water entering and leaving the cells is the same. Hypertonic solutions contain a higher concentration of solute than bodily fluids. Cells in this solution shrivel as water leave the cells. Hypotonic solutions contain a lower concentration of solutes than the bodily fluids, and in this case, the cells can burst as water rushes into the cells. You'll see that there's actually a slide that shows that in picture form. Crystalloids contain electrolytes, and this is used to replace lost fluid and treat dehydration. So crystalloid examples would include normal saline and dextrose. So if we have a patient that we give, earthquake. If we give a patient in the hospital a normal saline or dextrose, those are crystalloid solutions because they contain electrolytes in them. Think about what's in normal saline, right? Sodium chloride. And then what is in dextrose, okay? Colloids contain proteins and other large molecules. They act similarly to hypertonic solutions. These are used to increase the osmolarity of plasma, which pulls fluid from interstitial spaces. So some examples of that are albumin, dextran, and blood. So these typically tend to be blood byproducts. So albumin is used. The most I saw albumin used when I worked in the hospital was actually for our cardiac patients, so patients that were undergoing what we call a CABG. It's probably not the best term for that, but it's basically an open heart surgery where they were going in and, doing bypasses and stuff because the arteries are clogged, help preventing heart attacks from happening. These patients are receiving these, and the albumin is one of these drugs that you have to be aware of for cultural sensitivity. Because albumin is actually a blood derived product, then our patients, such as Jehovah's Witnesses that do not accept blood products, blood transfusions, they need to know what this is and have the option to accept or refuse. So cautions and considerations using hypertonic solutions. They're actually irritating to the tissues and blood vessels, and these actually must be administered via a central IV line. So when you have an IV line that is placed into the arm, they can place it in your hand, in your wrists, in your arm. If needed, they can go in through your feet, even into the veins in your neck. But when they place a central line, that is going directly into that main line that feeds into your heart. Sterile water for injection. So Swiffy, you guys have seen me write that. As pharmacy technicians, we typically deal with sterile water for injection when we're preparing IV medications, right? So a lot of times we use the sterile water for injection as our diluent to reconstitute our powder vials. So these should never be administered by themselves. So sterile water for injection is never administered alone. It can cause red blood cells to burst as the water rushes from the plasma into the red cells, and it leads to destruction of blood and release of intracellular material in mass amounts. So the next slide here actually lists the common crystalloid solutions. So hypotonic solutions include sodium chloride. They include, half normal saline, so 0.45% of normal saline, and it includes dextrose 2.5%, so D 2.5W. Isotonic solutions would be D5W, so dextrose and water 5%, normal saline 0.9%, and lactated ringers, which we refer to as LR. Hypertonic solutions are combination bags. So when we have a D5 half NS, so we have a bag that has both 5% dextrose and 0.45% sodium chloride contained within the same bag. D5 NS, which is 5% dextrose and 0.9% normal saline, again in a combination bag. So what solution has a similar concentration to blood plasma, and that is always going to be isotonic. Electrolytes. Electrolytes are molecular compounds that form ions when dissolved in water. They exist in the body as positively or negatively charged ions. Cations are positively charged ions such as sodium. Anions are negatively charged ions such as chloride, and these are measured in milliequivalents. You've seen some, let's see, some probably problems that we have done that has like potassium chloride is 10 MEQ, right? So your MEQ are your milliequivalents. Osmosis, the passive amount of or passive movement of water across cell membranes to maintain equal concentration of molecules on both sides. So the next slide actually breaks down the electrolytes. This is where you're going to need to do your assignment, okay? Use this slide here, slide 14 on your PowerPoint, and it breaks it down. So sodium, potassium, calcium, it describes the description of it and its role within the body. The next slide, 15, you'll also use magnesium, chloride, phosphate, and again, it gives a description and what their roles are. I'm not going to go through that on this this video because I want you to actually get in there and read it so you can do your assignment. So electrolyte replacement, we're starting on slide 16. So oral potassium. So we use oral potassium when potassium is lost, typically through diuresis. Remember when we had our renal pharmacology chapter and we were talking about the different diuretics out there? What do we tell our pharmacist, or what are we looking for when we have a patient that comes in with a prescription for a diuretic that is not a potassium sparing diuretic? We're looking for a potassium supplement prescription or order to go along with that, because when these patients that are taking diuretics that are not potassium sparing, the diuretics are getting rid of everything, the excess water and potassium included. Our bodies require potassium, particularly our heart, to be able to function correctly. Side effects of lost potassium and then also too much potassium can include nausea, vomiting, diarrhea, abdominal pain, and GI ulceration. So that's the oral version. IV potassium is also given. So sometimes we have patients come in and they're not able to take oral medications, or maybe they're very, very ill and their levels of potassium are extremely low. We're going to go an IV route to help get those potassium levels increased pretty quickly. Oral calcium, we use, you see that all the time, you know, calcium for bone loss. That's true. So even Tums has a little bit of calcium in him, but you can typically go into any health food store. You can go into Walgreens, you can go into Costco, Sam's Club, and they're going to have calcium supplements. And these are used to help increase our calcium absorption, how much calcium we're intaking, because we're probably not getting enough in our diet, which is then going to help increase our bone formation and decrease our bone loss, which helps prevent us from developing osteoporosis. Side effects of having too much calcium can be constipation and then kidney stones. Kidney stones are very famous for too much calcium. So typically if patients have kidney stones, they actually test to see what these stones are made of, and a good majority of these cases are actually too much calcium. Oral magnesium we use just for a deficiency of magnesium. So again, when you have critically ill patients that come in, or just even regular patients that are coming in for illness or surgeries or anything like that, they're doing blood draws, and in those blood draws they're looking for many different things, and one of those included is what their electrolyte levels are. You can find oral magnesium over the counter, and again at any of those stores that I mentioned before. Taking too much oral magnesium can lead to diarrhea. We give IV magnesium for preeclampsia, eclampsia, or preterm labor. So preeclampsia and eclampsia are two terms used to describe the increased blood pressure of pregnant women. This is something that is monitored very closely throughout a woman's pregnancy. Typically, if they start to see preeclampsia symptoms, they are going to get in and actually probably deliver the baby very quickly, because once the woman moves into eclampsia phase, that's actually one of the number one reasons why women die in childbirth is from the eclampsia. They also use magnesium to stop preterm labor. So if a female or woman starts to go into preterm labor, sometimes it just happens. Sometimes they could have ingested or come across something that has induced their labor, and they go in, they check the baby out, they do sonograms to make sure that it's safe to stop the labor, and then they can administer IV magnesium. Phosphorus is typically only given from malnourishment, and those are very rare cases. If we've had a case where an elderly person has either been neglected in a home or maybe has been living on their own and not eating and drinking like they should, sometimes we see this in neglected children, and typically in other parts of the world where they don't have as much food and nourishment and supplements and stuff like that, we see the use of phosphorus. Most electrolyte products are not to be used in kidney failure or impairment, and if they do use these in kidney failure patients, it's closely monitored. Injectable potassium must be diluted and mixed well before administration, must be given slowly. The maximum safe concentration is 80 MEQs per liter. The black tops of the vials of potassium all have black tops. So we've talked about this before, some of you that have been in class for long periods of time. And if you think about prisons and death penalty prisons that still carry out the death sentences. So the humane way in their eyes is going and doing a lethal injection. Well, the main drug that is used to stop the heart is potassium chloride. And so they give a large concentration, just an injection. This is telling you that it must be diluted. They do not dilute the potassium chloride in lethal injections, and that is actually the last drug given to stop the heart. We have pre-made potassium chloride bags where the 20 MEQs has already been added into the liter for us. These are kind of pre-made for us. These are very helpful. Otherwise, we're making them all on our own in the IV room. But that's one thing that we should always be aware of, is that in a hospital setting, there should never be an order for just straight potassium as an injectable version. That's always going to have to be diluted in at least a liter of fluid. Calcium and phosphate. So this is important if you are going to be going into a hospital setting and you're going to be compounding TPNs. TPNs are total parenteral nutrition, so it's basically what I call food in a bag. We have patients that are intubated. We have patients that are unable to eat and drink, and so we still have to feed them essentially. We still have to give them their nutrients, and that's what the TPNs are. The TPNs are a mixture of amino acids. We can add fat or lipids to those, and then we typically add in additional electrolytes depending on what the patient's blood labs came back as. When you are preparing these, you can never add calcium or phosphates together. So let's say we have a calcium gluconate and we have an order for a potassium phosphate. You have to give those one at the beginning and inject everything else in between, and they add the last one at the end. The reason for that is if they're added at the same time, it causes a potential for chelation, or what we call like a gelling up, and that can be fatal to the patient. Last slide that we're going to go through here is acid-base balance. So acidosis, we covered this a little bit in our first chemistry, especially our acid and bases PowerPoints that you were reviewing. So acidosis occurs when the extracellular fluid contains excess hydrogen ions, which causes the pH to drop below normal range. So remember, on your pH scale, it's opposite of what you would think it to be. Our acids are the low numbers and our bases are the high numbers. Metabolic acidosis occurs when excess acid is produced, bicarbonate is lost, or the kidneys do not excrete enough of the acid. Respiratory acidosis results from slow breathing and retention of carbon dioxide in the blood. So when we breathe, we are exchanging oxygen for carbon dioxide. We breathe in the oxygen, we exhale the carbon dioxide, and that transfer of gases happens inside of the lungs. Alkalosis occurs when there is a loss of hydrogen ions, producing an increase in bicarbonate, which is the base, right? So think about sodium bicarb. Think about Tums. Those are all bicarbonate base. Those are bases, and which increases the blood pH. Metabolic alkalosis occurs when excess acid is excreted by the kidneys or lost from the stomach. And respiratory alkalosis results from rapid breathing. The more carbon dioxide is inhaled and more carbon dioxide is exhaled and eliminated from the blood. So tomorrow we'll finish up looking at the acid-base balance. In the meantime, you have an electrolyte assignment to complete. And if you have any questions, be sure to email me. So your assignment on Friday, you will watch this lecture video. You will start to review chapter 17's PowerPoint, which is in your lecture folder, through about slide 18. You'll complete the assignment, and again, it's imperative you have discussion boards in both classes. You need to be participating in those. So go ahead and get those done. Through the weekend, I'll get everything graded for you and posted to your Blackboard. You do have a Chapter 3 review that I've put into a folder for you to use to review for your Chapter 3 quiz in chemistry on Monday. Email with any questions, and other than that, you guys have a good weekend, and I will see you later.